Morning, Ohio. This is Jessica, and here's today's weather report. In the morning, we are expecting sun, but around noon there's going to be a little bit of snow. In the evening, there's a slight chance of a little bit. Wait, save the weather for later on because this is going to be more important. I have some breaking news. There has been a lot of coughing sighting in the downtown area, but it's mostly young adults. When asked, they said that they smoked. This seems like a major case of COPD, which, by the way, stands for chronic obstructive pulmonary disease. Let's head over to our COPD specialist for more information.
COPD is a life-threatening disease caused from smoking. It can't be cured, but takes a lot of treatment for symptoms which include coughing, which can be dry or with phlegm. Respiratory is fast breathing and frequent infections, shortness of breath or wheezing. The whole body can be inability to exercise and you get tired easily. And then also common is acute episodes, anxiety, bulging chest, chest tightness, depression, fast heart rate, hard to exercise, muscle weakness, sleeping difficulty, or weight loss. Here are a few questions and answers concerning COPD. What is COPD and what causes it? Cigarette smoke and other irritants cause COPD. In most of the cases, the lung damage that leads to COPD is caused by long-term cigarette smoking. But there are likely other factors that play in the development of COPD, such as genetic susceptibility to the disease, which means you can inherit a weakness to smoking, which can cause you to get COPD more easily, and because only about 20% of smokers develop COPD. And then, is chronic obstructive pulmonary disease contagious? It is not an infectious disease, so it is not contagious. The most important cause of it is cigarette smoking. Chemicals in tobacco can also give you COPD. And over my time as a specialist in this field, I've met a few people who are willing to share their experiences with COPD. And the first one is Gina.
I've had COPD since I was 25. It's been hard for me to go through a lot of therapy. It isn't fun, but I just want to tell you that smoking isn't worth it. I've been living with my cat for 10 years. And I'm surprised he didn't die yet. He was my only company. He had to deal with a lot of my bad days and my bad behavior. And he has been through so much. Sorry about that. The cat got a little out of hand. Okay. Where was I? Oh yes, my cats have been through so much, but really I think I should switch to dogs. And it ain't fun to have this disease. I suffered many days thinking I was gonna die, and mostly from that cat. It's hard. I just want to warn you all, youngins out there, do not smoke and do not have cats. It's bad for your brain and your heart. Thank you.
She has not changed. Anyway, the next person is someone who is one of my current patients, and she is very hard to work with. She's 18 years old, has COPD, bronchitis, and emphysema, and her name is Alex Brown. What is your name?
Alex?
Hello, Alex. Would you like to share your COPD story with us?
No.
Will you please share your COPD story with us?
I don't have a choice, do I?
Well, not really.
Okay, fine.
So when did you start smoking?
15.
What made you want to smoke?
All those dumb commercials that told me not to smoke.
Well, it's bad for you. You can get lung disease, cancer, bronchitis, emphysema, and COPD, 3 of which you already have, which is why you're here to tell us about living with them.
Well, you learn to live with them. My bronchitis usually goes away after a while, but I get it about once or every 2 months.
What kind of treatments are you on?
I have an inhaler that I use every day. I'm also on steroids, which I take once a day. I take fluticasone with my inhaler, and my steroids are salmeterol, which I take by mouth. I also have to go to the gym every day, my doctor does, and to my doctor once a week.
Okay, what do your medications do for you?
Fluticasone prevents itchiness and any asthma attacks, and salmeterol treats my COPD, bronchitis, and emphysema.
Do you like taking your medications?
Why would anyone like it? Especially when they taste like car exhaust. Always coughing too. My throat hurts when I talk too much, and it's really hard to go to sleep.
So you regret smoking?
No,
What? Why not?
I don't regret smoking. Okay, maybe a little bit. But it's not fair because all my friends are all healthy and they keep on smoking without meds. I hate my stupid diseases.
Okay, well, I think that's a good stopping point. Thank you for your time, Alex.
It's not fair. This party sucks. Yeah.
Drink Diet Coke.
Ever make a mistake when you're doing makeup?
All the time. This is so annoying.
You need makeup on. It's amazing. Oh my god. You're so beautiful, Ken. Oh, that's great. Isn't it great? Round of applause.
Alex is a little crazy, but she'll get through it. Anyway, we have one last interview.
What is your name, ma'am?
Hi, my name is Julia Finn.
When did you start smoking, Julia?
I started smoking when I was 18.
How old are you now?
I am 47.
What were the different symptoms that you experienced?
I had coughing and wheezing, and I had lung cancer.
What different symptoms were you experiencing?
Well, at first I would get breathless after activities that I did. Then I began to get breathless again after just going for like short walks, and I would have a terrible cough, and I was experiencing COPD, and then I told my doctor.
What kind of treatments were you prescribed by your doctor?
Well, I had an inhaler which I use quite often, and I joined a group to help me quit smoking, but I actually still smoke sometimes. And I take, I take daily antibiotics, so that helps me too.
Okay, what is your story of why you started smoking exactly?
Well, I started smoking while my mom was smoking, and then she told me not to smoke. So I just decided I wanted to smoke.
And what is your advice for people who are deciding whether or not they should smoke?
You shouldn't, because once you start smoking, you kind of get addicted to it. You can't really stop, and it's very hard to stop if you do stop. And you can have like lots of stuff wrong with you, and it's just better if you don't
don't smoke.
Is there anything else you'd like to say before we end the segment?
Nope.
Sure.
I'm sure.
Positive?
Smoking can make you age faster.
What? Okay.
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 Alrighty.
I'm gonna throw my cigarette at you.
Now, so folks, now let's head back over to the station. Okay, hopefully those stories from those personal stories helped motivate you not to smoke, and you definitely don't want to end up like Gina Finn.
Well, thanks for watching, and yeah, it was.
Mark Rothschild's in the news station! Call the police already! You need makeup wipe! Really? You left me. Ready?
Elise, get out of here!
Mm-hmm.
We could just use Elise. Good morning.
My neighbor, some old freak.
Your neighbor's not an animal.
Done.
What? Are you still?
Hello. Mary. Is that your mom's hair?
So you're gonna say like.
Please get down. Don't smoke, avoid getting COPD, and don't be like Gina Finn.